The key ingredient for medical tourism, and we've learned this from experience of 2.5 decades now, is establishing trust, because no one is going to travel to another country unless that is truly established. Some statistics tell us that by 2029, this is going to cross $100 billion. It's a significant industry. It's a huge industry that many countries have already tapped into. And I feel it offers a massive opportunity for us in Pakistan as well. India, Thailand, Turkey are some of the biggest operators in the medical tourism market. And there's so much experience share that can happen, and there's so much learnings that can happen over here. First and foremost is the healthcare workforce that we have. Pakistan has more than 180 medical and dental colleges, and there's more coming up all the time. Allied health professionals are being produced in a massive number, and there's a constant increase. And I have to say that while there is a huge need for the quality to be standardized and improved, but the numbers are there. So you've got a workforce, an English-speaking workforce, which is a key ingredient for any healthcare sector in any country. There are so many Pakistani clinicians doing wonderful work all over the world, and some of those clinicians choose to come back to Pakistan. Those are individuals who understand international standards of care, they understand patients' expectations, communications, transparency, and that really offers a natural bridge for the Pakistani healthcare providers with the global standards. 10 million Pakistanis who are living outside Pakistan right now, and those Pakistanis do have healthcare needs. We're all familiar with the problems, the waiting times in the United Kingdom and many other countries, and the affordability issues as well. They're familiar with this country, there's no language barriers, and they get an opportunity to come back home, obtain treatment, and then go back to the countries where they're living in. In many cases, we share a similar culture, we share the same religion, we share similar values, and that cultural comfort at times can matter a lot more than the price. And lastly, there is a price advantage. It is important to recognize that as well. For a comparable level of quality, Pakistan still offers a very competitive price. 2001, 2002, when RMI was just starting off, as some of you might be familiar with the geopolitical situation in our neighborhood back then, a new government was coming in, there was a war happening in the neighborhood, and suddenly you had a country that did not have any healthcare infrastructure, that now suddenly had a lot of resources being pumped into that country, and it had people who were requiring that healthcare. And we had a very porous border, which meant that people could literally walk across for services that they needed. And right at their doorstep, Peshawar being very close to the border with Torkham, you have a brand new hospital offering all tertiary care services that had sprung up. Within the first couple of months, we were flooded. All the capacity was fully booked, and we were aggressively working on expanding. We added more beds. What started off as a 100-bed hospital rapidly grew. What started off as 2 specialties turned into 20, and we just responded to this demand. And we therefore became the most convenient and the most obvious destination for all of those medical tourists from Afghanistan that were coming over. We had a lot of patient education material, but a lot of that was in English and Urdu. So we started translating that and producing that in all the regional languages as well. They would come in with a different currency, so we established a currency exchange on campus. They would come with their companions and family members, and they needed accommodation, and it was not easy to find accommodation in Peshawar, so we established on-campus accommodation for them, transport, a shuttle service to the border, visa facilitation, telemedicine consultations. The patients taught us what they require, and we responded. And that is why we probably handled one of the largest volumes of international medical tourists into Pakistan along the way.